What's up, guys? It's your girl Michelle Victoria, and I'm back. I know. Let me address the elephant in the room. It's been a whole long time since I posted the last video. I know, I'm so sorry. It's just been a lot. It's been crazy busy, but I'm back. Subscribe, like, share some comments. Yes, I'm so sorry, guys. I know it's been such a long time. Nursing school sucks. Like, it's a lot. So bear with me, but I will try my best to start pushing out some more content on a more regular basis. So yeah, stick along for the ride. Let's get into the video. Okay, so getting into this video, I have my handy dandy iPad with me because you guys know my memory is absolutely trash. And I talk a super lot. Like, I will start blabbing and go off. This video will be 2 hours long. So this is kind of just to keep me in check. So first things first, I want to kind of explain what an accelerated program is. So my specific program is a 6-semester or 2-year program. It is considered a second degree entry or second entry degree program. So essentially the requirements are that you have to have completed 60 credits, 60 university credits prior to applying. So that equates to pretty much 2 years of a university degree, or you can have completed your degree in totality before applying. So for me, I completed a whole 5-year degree at U of T prior to applying to the program that I'm in now. So I already have a degree, but other students in my program are transfer students from the same school. They just transferred into nursing after 2 years, or other students did 2 years in another college and then transferred over to nursing. So as long as you have those 60 credits, you can apply. My program is also very intensive in that it's essentially a 4-year program smushed into 2 years. So it is a lot, but that's essentially what an accelerated program or a second degree entry program is. It's essentially for students that have completed 2 years of a degree or a full degree and now wish to pursue nursing. It's a little bit of a fast track to do that. And one thing I should mention is that it is an RN program or a registered nurse program. Oftentimes when I tell people I'm taking a 2-year program, they automatically think, oh, that's RPN. No, it's an RN program. So when I graduate, I'll be writing my NCLEX RN, and I'll be getting my Bachelor of Science in Nursing. So it's a full bachelor's in 6 semesters. So you can imagine. So yeah, that's essentially what a accelerated program is. How does it differ from a 4-year program? Well, it's 2 years, but it's also more intensive. Like, I find you don't get as often as a break as you do in a 4-year program. So like, my school also offers a 4-year program, and they get summers off, the whole summer. Like, they get finish in April, they get summer off, they go back in September. We don't do that. So my program is structured fall, winter, summer, fall, winter, summer. So you pretty much only get 1 to 3 weeks, if you're lucky, of a break in between semesters. They try to schedule all of our exams within the first part of the exam period. So it's good and bad because most times, like, you literally will end class and then a few days later, boom, first exam. So it's a lot, but you get out of exams earlier, so you have a little bit more of a break because we don't really get a break. We're kind of just going. So it's definitely more intensive, I would say. And again, it's because they're trying to get all the information that you wouldn't necessarily get in a 4-year degree now into 2 years. So the workload, in my opinion, is a lot, probably a lot more. Like, I can't really speak on a 4-year program because I've never been in it. I have friends in it, but I've never been in a 4-year program. But personally, like, the workload is a lot. It's very intensive. Like, I worked throughout my first couple of semesters. I'm still working now, and it's a lot. I'll make a whole separate video on like working in nursing school, but it's definitely a lot. do you get less clinical hours? This is a question I actually kind of got asked a lot. I wouldn't say we get less clinical hours because we do get a pretty significant amount of clinical hours and a lot of like clinical experience, I would say. So I'll just give a quick breakdown of how my program is structured. So like I said, fall, winter, summer, fall, winter, summer. So fall semester is like our long-term care semester. So we're placed in long-term care and our courses are based around the foundations of nursing theory, professionhood, nurse-client, therapeutic relationship, that sort of stuff, and your first health assessment class. So that's pretty much first semester. Second semester, we move into an actual hospital facility and we're in active rehab or rehabilitation. So again, getting a little bit more acute as the program progresses. So now we move into actually being able to give medications with our preceptor, with the preceptor's guidance. And our courses are, again, getting more intense. So now we're taking the pharmacology, pathophysiology, complex health assessment, just more acute, moving into more acute. Summertime is when you're actually in acute care, so you're in a medical surgical unit, and now you're learning complex assessments, you're learning how to assess abnormal patients or patients that are presenting with abnormal things. So first and second semester, you're learning assessments on patients that are stable or within the normal, I use the word normal very loosely, but normal ranges. And as you progress, you start assessing patients that are abnormal or they just don't fall within the normal range. They're starting to present in a more unstable manner. And in your placement, you're giving meds and now you're also giving injections and you're doing like sub-Q injections or heparin depending on your facility, or you're doing insulin injections, you do a lot of those. But you're just starting to get a little bit more into the acute care realm. Your next semester, which was fall, which is the one that I'm currently completing right now. I'm actually in final exams right now, so yeah. But this is community. In this semester, you're not in hospital at all. You're not in acute care at all. You actually don't even really have patient interaction. Like my stethoscope is sitting over there collecting dust because I have not used it in a whole 12 weeks. But this semester in community, you're placed in a more public health setting. So it can be a school, it can be a library, it can be a public health facility. It just depends on what's available and what you get put in. You're placed there and your courses are now structured around literally almost nothing acute. It's just leadership, research, and then you get, for my program, you only get 2 electives. So your first elective falls in this semester. I personally took advanced pediatrics, because I wanted to go into peds and I wanted to kind of hold on to whatever little glimmer of acute care I could get, which was through that course. So I took advanced peds. And then your 5th semester, which I'll be moving into in January, is considered your mental health or pediatric semester for my specific program. So you either get placed in mental health or you get placed in pediatrics. There's no, like, it's either or, there's no crossover. You're either in a mental health facility or you're in a pediatric facility. You get to like rank your preference. Well, so they say, we never actually got that though. So you're either in mental health or you're in peds, and you're kind of moving back into acute care again. And your courses are now preparing you for the real world. So you're taking an advanced professionalism course, which kind of teaches you how to build a resume, cover letter, how to apply for jobs, things like that. You're taking global health, so you're looking at health on a broader context. You're also taking your clinical course, and then you have one more elective. I decided to take clinical decision making. Yes. In your 6th or final semester, you do your integrated practicum, which is what we short form as IP, and I think in the States or other places they call it your preceptorship or your consolidation. This is pretty much where you're assigned to one preceptor nurse and you follow him or her for the duration of the time you're in that semester. So for us it's 4 months, and literally whatever that nurse's schedule is what becomes your schedule. And you follow them around for the duration of the semester, and that's where I feel you learn the most, because it's one-on-one with that preceptor for the whole 4 months. So you kind of get to start to build your individuality as a nurse. You kind of start to get more comfortable kind of doing things on your own. I wouldn't say you get less clinical hours than you do in a 4-year program, because as well too, we have labs. So my program, we have a nursing simulation lab in our nursing building, and it's like a high-tech, relatively high-tech lab. Like we have 2 super high-tech mannequins that breathe, they talk. They use a computer and they can actually like adjust heart sounds. They have pulses. You can send your patient to cardiac arrest, like the mannequins. Like you can manipulate them in all types of ways. Very high tech. And then we have standardized, I don't want to call them dolls, mannequins, right? Standardized mannequins that don't really do much, but you can still manipulate them in certain ways. Practice like where you would do your landmarking, things like that. And so we use that. We have that lab too. And you're in that lab for both assessment courses and for a few of your clinical courses, you're in the lab. So I wouldn't say you get less clinical hours. I think it just depends on how your program is structured. Thankfully, my program gives you the opportunity to practice a lot. Like we even have, outside of lab time, we have facilitated and independent lab sessions where you can actually sign in and go into the lab. And you can either practice skills on your own, or you can practice with a clinical instructor that's available, that's there, that will walk you through like how to do vitals, how to do a chest assessment, how to do respiratory assessment, like whatever it is, like they'll walk you through the assessment and you can practice kind of on your own time there. So you still get a pretty good amount of clinical hours. The one thing I will say is the workload, it's intense. And again, understandably so, because they're taking a 4-year program and putting it into 2 years. So the workload is very intense. You don't get the summer because you're in school full time for the summer. The workload is intense and it's a lot of information. It's a lot being thrown at you at one time because not only are you in full-time courses, but you're in clinical as well, and then you have lab, and then there's just a lot. Like the information is very heavy, and again, it's because they only have 6 semesters to groom you into a nurse. So they're really putting on the work. And so it's really up to you to kind of stay on top of that as best as you can. But that's essentially how my program is structured. Would I recommend somebody doing an accelerated program? To be honest, I can't say if I would or wouldn't. It worked out for me because I already have a previous 5-year degree. Like I've already graduated with my bachelor's, so I did not want to do another 4-year degree, even though I'm technically still doing that when I eventually pursue medicine. But I just did not want to take that route right now. Like I just wanted to start making some money so I could start preparing myself to go to med school. But I feel like if you really think you can handle it, like handle what comes with an accelerated program, then definitely take a look at your accelerated programs, but just be prepared to know that it's a huge sacrifice. Like your social life will deplete, it will be non-existent, because a lot of your time will be spent in the library or at home studying or catching up with readings or just trying to stay afloat. Like I'm not gonna sugarcoat it, it's not easy. It's definitely doable, definitely possible, but I feel like it just requires just a little bit more work. That's just my personal opinion. Again, I haven't actually taken a 4-year nursing program, so I can't really speak on it, but that's just kind of what my opinion is, having experienced a 2-year accelerated program. That's pretty much it for this video. I hope you guys enjoyed my little spiel about accelerated nursing programs, and if it's for you, and just my take on it and my experience going through it. Like I said before, I'm in my community semester now, wrapping up final exams. So I actually have one more exam left before I go on vacation. I need a break because nursing school burnout is a real thing. But that's a whole nother video, which I will record, I promise. But yeah, if you enjoyed this video, be sure to give it a thumbs up, subscribe, like, and comment. Hit your girl up in the comments. Any questions you have about nursing school, anything, hit me up. I want to talk with you guys. I want to communicate with you guys. I promise, I will try to do better with posting videos. Just bear with me, y'all. Like I said, accelerated programs are a lot. There's a whole lot. Anyways, I will see you guys in my next video.